Rheumatoid arthritis diagnosis, medical treatment, rheumatoid arthritis symptoms. A chronic autoimmune disease called rheumatoid arthritis can make joints hurt, swell, and stiffen. Although there is no cure, early diagnosis and therapy can help manage symptoms and stop long-term joint damage. When your immune system, which is supposed to defend you, goes haywire and starts attacking your body's tissues, the problem begins. The synovium, which lines your joints, becomes inflamed as a result. As a result, your joints can become painful, warm, swollen, and red. RA typically damages both sides of the body's joints. So, if one joint in your arm or leg is damaged, it is likely that the same joint in the other arm or leg will also be damaged. That is one way medical professionals distinguish RA from different kinds of arthritis, such as osteoarthritis, OA. Hi viewers, early RA diagnosis provides the best treatment outcomes, making symptom awareness important. From types and symptoms to home remedies, diet, and other treatments, watch the video to learn everything there is to know about RA. Symptoms of rheumatoid arthritis. 1. Painful and swollen joints. 2. Stiffness, especially in the morning or after sitting for a long time. 3. Fatigue and weakness. 4. Stiffness or soreness in multiple joints, more than one joint. 5. Minimal fever. 6. Deformities and a loss of joint function. 7. Across both sides of the body, the same joint symptoms. 8. Reduced appetite. Everyone is affected by rheumatoid arthritis differently. Some people develop joint problems gradually over many years. Others may experience it faster. Who is affected by rheumatoid arthritis? RA can affect anyone. 1% of Americans are affected by it. Men usually show more severe symptoms, even though the disease affects women 2 to 3 times more often than men. Typically, it begins around middle age, but older people and young children also may get it. Causes of rheumatoid arthritis. 1. Genetics. Because RA often runs in families, the disease may have a hereditary component. 2. Environmental factors. Certain environmental variables like pollution, smoking, and contact with infections can trigger the onset of RA. 3. Immune system dysfunction. RA is an autoimmune disease, meaning the immune system mistakenly attacks healthy body tissues, including the joints. 4. Hormones. Women are more likely to develop RA than men because of hormonal changes. Estrogen can be a factor in joint inflammation. Elements of risk. 1. Live births throughout history. A higher risk of RA may exist in persons with ovaries who have never given birth compared to those who have. 2. Obesity. Obesity can enhance one's likelihood of acquiring RA. 3. Smoking. According to the study, smokers have a high risk of getting RA. 4. Diet. High intakes of sodium, sugar, especially fructose, iron, and red meat are associated with a higher risk of developing RA. 5. Age. Adults in their 50s are more likely to get RA. How do physicians identify rheumatoid arthritis? There is no single test that can determine whether someone has RA. In addition to performing X-rays and blood tests, your doctor will examine you, inquire about your symptoms, and complete a physical examination. Several factors are taken into account in the diagnosis of rheumatoid arthritis, including 1. Stiffness of joints in the morning. 2. The symmetry and position of painful joints, especially those in the hand joints. 3. Rheumatoid nodules, or bumps and nodules under the skin. 4. X-ray and blood test results. Treatment for rheumatoid arthritis. In addition to controlling the inflammatory response, RA treatments can help manage pain. It often leads to remission. Reducing inflammation can help prevent further damage to joints and organs. Medication, relaxation, exercise, and, in certain circumstances, surgery to repair joint injury are all forms of treatment